It's an interesting situation because the Victorian government says, well, we've made sure and it's definitely safe now. Some of these places haven't had a case ever during COVID. Was it a proportionate response?
Look, I think it's a bit over the top is the best way to describe it. The thing that really infuriates people is these lockdowns are ruining people's lives and livelihoods, both their mental health space. The existence of these rural communities relies on them being to get around and travel. Now, if there's no cases anywhere, it just defies logic that they would extend it in such a broad brush fashion. So I'm really pleased they're lifting it tonight. I'd like to compliment the member for Mallee for her great advocacy to get Mildura opened up again in the west of Victoria, and a lot of those other regional people like the member for Nichols and all of them were saying the same message. If we've got cases, they'll cop it sweet, but they weren't getting any cases, so it's great that it's lifted.
So the concern has been around spread and people driving places and so on. You're hoping they don't do this again. If they do and there are cases, will you say, well, gee, I was wrong? You're prepared to sort of say you're confident in things not popping up in regional Victoria enough to say, this is what you should do and I'll stand by that whatever happens?
No, look, I think you've got to deal with the evidence. And the evidence was there weren't cases appearing for a very long time. And just to lock up the whole state without evidence behind it of community transmission or isolated cases in that area, I think, as I said, it was over the top.
OK. Interesting move on the vaccines last week where the first move from New South Wales was to take them away from the regions to HSC students. We know the federal government ended up topping up the vaccines. What did you make of that? Is that fair enough given the outsized risk in the cities compared to the regions?
Well, that was their logic. It was their call. It was a big call, I might add, and there were a lot of people, including me, who were taken aback by it. But I can say the Commonwealth vaccination program didn't change. We still rolled it out to GPs and to the pharmacies who'd been approved and to the community Commonwealth vaccination centres and the in-reach into nursing homes. That didn't stop. But look, I can follow the logic of the New South Wales government because they were thinking, gee, we've got all these high school students in big examination rooms. Do we want to turn the HSC into a super spreader event? So they're focusing their guns where the problem was. And it's fortunate that the Commonwealth has got extra doses coming in from Pfizer that we could redirect it back out into those areas.
So Year 12, I mean, this is a quick action to try to get people back into classrooms, but outbreaks can happen anywhere. Is there any work going on to preemptively vaccinate the rest of Year 12s around the country, or are you just leaving that up to states?
Look, the states, once they get their allocation, it's their call. Obviously, with the epidemiologists identifying that young people are good spreaders.
And the importance of Year 12.
And the importance of Year 12. There was a logic to what they did.
Would you urge other states to do it preemptively, though?
Look, it's their call. If they were in Sydney's position, which they aren't, they might have reached that decision. But look, everyone is very jittery about trying to prevent the spread of Delta. It's great to keep it localised as soon as possible. Preemptive, short, sharp lockdowns are making people's businesses really suffer, and I really feel for them. The sooner we can get the whole community vaccinated, or as many people as willing to have it, get above that 70-80%, I think we'll see that as a feature of the past.
OK, and just on getting people, so compulsory vaccinations and what workplaces are looking to be able to do, the federal government has essentially said we're not going to pass new legislation, we'll leave it up to workplaces. And that would be dictated by whether it's reasonable for a workplace to demand that. So what does that mean? What's an example of a workplace that should be able to enforce that, in your view?
Oh, look, it's pretty much common sense, Tom. I think, if an airline wants to say we'll only take passengers that are vaccinated, that's a fair call by them. They might have some passengers that want to prove a point and take legal action against them for discrimination. But look, the Commonwealth government has decided we are not going to mandate it.
Okay, but
we encourage it highly. It's common sense.
But I'm just trying to ascertain where the government thinks it would be reasonable. So airline, you said yes. What about a pub? It's all at the moment, a lot of the businesses indoors. Could they do the same thing with patrons?
Look, that'll be up to those businesses. I'm not going to mandate what they should, but you would want to have a pretty good argument for why you're mandating it.
What's the difference there? Because you said this is common sense. So what's the difference between a plane and a pub in that sense?
It's a question of density and how close you are and all those sort of things. Like I said...
So a sporting event, then when you've got the density, say...
Well, that's why they limit numbers at these sporting events.
Should they be able to have the same right to have patrons?
Look, I want everyone to be able to get back to normal life. And
I understand that. We all want that.
The quickest way to that is to get the largest portion of the population that's willing to have a vaccine vaccinated.
I understand
and then
that.
also maintaining those common sense hygiene and separation and crowded, dense rooms, wearing masks, all that stuff reduces the risk. But we can't make it risk-free.
I understand it, but that's not what I'm asking. I'm asking which businesses, under your definition of common sense, would be able to have that right for either their workers.
Well, they don't have a right. They would make that case.
But that could still be tested.
It could be tested. Like I said, they might end up being challenged in a court, but that's their call. I'm not going to mandate that they have to or that they can't. Most people would respond in this current pandemic with thinking that's quite reasonable. But we're not going to mandate it. At the very beginning, the Prime Minister said, we highly, strongly urge everyone to get vaccinated, but it's not mandatory. But look, some of the states...
People have very different definitions of what's reasonable. That's the issue here. Isn't there a role for government to decide what businesses can do this rather than haphazard? One cafe says you're not coming in. Maybe that cafe gets taken to court. Maybe not. I mean, which individual patron will take a cafe to court? Isn't there a role for government here to figure out what's reasonable?
Look, I believe in small government, and we have got the courts to decide these matters. What the states have done, they have enacted public health orders that they've always had. And I might add, Tom, many people come to me and say, well, like, why has the government surrendered all this power to the states? Why doesn't our Prime Minister stand up? The reason is the states have had these powers since the Commonwealth was formed. And even John Howard mentioned it the other day in an op-ed in the Weekend Australian, that the states have always had these powers. They've just lain dormant, probably since the last pandemic in 1920.
Can I ask you finally, a lot of opprobrium for Labor's $300 per jab payment. The government is actually paying doctors to give the jab. So doctors going into aged care centres for workers and disability workers, aged care workers, doctors get $1,000 after they vaccinate 50 people and $20 per worker after that. Why is it offensive to offer individuals a vaccination but good policy to pay doctors to give them?
Well, it's because it's their job.
But this is on top of their salary. This is incentive.
Sorry, if you could...
This is a $1,000 bonus. If you're a doctor and you vaccinate 50 aged care workers, you get a $1,000 bonus.
Oh, look, I'm not privy to those financial deals. I know
this was announced last week.
We have put forward payments to aged care centres to get contractors in, whether they're pharmacists or whether they're doctors.
This is a bonus to doctors, though.
Well, doctors, every time you see another patient, you get a bonus because they deal on payment per care.
This is on top of that. They get their Medicare payment, all that sort of thing. This is a $1,000 bonus if you get 50 workers vaccinated.
Look, I haven't seen that in any...
Is it a good policy?
I haven't seen the details of that, Tom, so I don't want to comment about something that might just be hearsay. I haven't seen it.
It's not hearsay, it's a government release.
Yeah, OK, well, I have to see that release.
Well, I've just told you, though, so if you vaccinate aged care workers, 50 of them, and you're a doctor, you get a $1,000 bonus. Is that appropriate?
Well, that's about $20 a...
Yeah.
So that's about what you get paid in a general practice.
But it's on top of that.
But in a general practice, you don't get a wage. You get billings per case seen. That's how the whole Medicare system works. People in a hospital are generally salaried, but look, the contractors that also go in, like Aspen, it's a commercial arrangement.
All right.
And doctors are no different.
Well, perhaps you can get an opportunity to take a look at it and we'll see your thoughts on it.
OK, Tom, no worries.
David Gillespie, thanks for your time.
Thanks, Tom.